Back injuries are the #1 workplace safety problem in the nation, as reported by OSHA, the Occupational Safety and Health Administration. Back injuries can be very painful, turn into long-term or lifetime disability, and expensive to diagnose and treat. Your back is the main support structure of your entire body. Along with your muscles and joints, it allows you to move, stand, sit, and bend. But your back is also a delicate, finely balanced structure that can easily be injured if it is not cared for properly. Knowing the basics of back care can make the difference between a healthy back and an aching one. This training program is designed to inform and educate any and all employees whose job requires them to lift, sit, or stand on the proper ways to protect themselves from back injuries. This training program will instruct employees regarding the structure of the back, common back problems, proper lifting techniques, posture, and maintaining a healthy back. The back is made up of many components. These consist of the spine, spinal cord, and muscles. The spine is the part of the back that supports the trunk and head. It protects the spinal cord as well as giving flexibility to the body. Vertebrae are small bones that form the spine. They are connected together by discs which act like shock absorbers. With the brain, the spinal cord makes up the central nervous system. There are 31 pairs of nerves that extend out of the spinal cord and into the body. There are approximately 400 muscles that help stabilize the spine and help with the proper posture. More than 1,000 tendons connect these muscles to the spine. There are several injuries that can occur to the back. Injuries are often the result of years of neglect, causing the back to become weak. Any sudden movement or improper lifting technique can cause injury. Back pain can last as little as a few days to several years. Some forms of back injuries include strains, overflexion, sprains, overextension, ruptured disc, pinched nerve, and muscle spasms. Strains are caused by overstretching, bending and lifting incorrectly, slouching, and carrying extra body weight. Strains occur when muscles in the back are overused or overstretched. A herniated or slipped disc results from repeated strains or overstraining and are usually very painful and cause lost time at work. This is when the jelly-like fluid in the disc leaks and puts pressure on the surrounding nerves of the spinal cord. The loss of fluid in the disc also allows the vertebrae to rub against each other. Overflexion is another type of back problem workers face. This is caused when you bend over too far, causing pressure on the discs in your spine. The result of this is pain and stiffness. Another form of back injury is sprains. Sprains are caused by sudden movements or twisting of the body. Sprains are usually ligament injuries because the muscles don't have time to react. These types of injuries are usually the result of accidents or falls. Overextension of the back is caused by arching backward too far and putting all of the weight of the load on the facets between the vertebrae. A ruptured disc is the tearing of the disc, releasing the jelly-like substance. Although injury to the outer covering of a disc can cause pain, often a ruptured disc by itself does not cause any discomfort. Pain occurs when pressure from the ruptured disc is put on the nerve roots or spinal cord. Another common form of back problem is the pinched nerve. A pinched nerve occurs when too much pressure is applied to a nerve by surrounding tissues. This pressure disrupts the nerve's function, causing pain, tingling, numbness, or weakness in the affected area. And finally, muscle spasms are another form of back problems faced by workers. Muscle spasms are involuntary contractions of a muscle, often caused by receiving too many impulses from the nerves, causing it to contract beyond capacity. To minimize the possibility of a back injury, employees need to practice safe and correct lifting techniques. The following technique should be utilized when lifting all objects, big or small. Plan ahead. Before lifting an object, know where it will be placed. Be sure the path you take is clear of any obstacles. This will help prevent any awkward movements while carrying the load. If lifting with another person, agree on the plan beforehand. When ready to pick up the item, make sure to bend at the knees and keep your back straight. Focus on keeping the spine straight to shift most of the weight off the back and onto the legs. Keep your eyes up and look straight ahead. This will help you keep your back straight. Your feet need to be kept at a shoulder's width apart. This gives you a more solid base to help provide more support. If your feet are too close together, good balance will be too difficult to achieve. If your feet are too far apart, your movement will be greatly reduced. When making a turn, move your feet into the direction you wish to move. Never twist your back. You should tighten your abdominal muscles when lifting an object. Keeping your abdomen tight will help your back stay in a good lifting position and help you keep from straining your back. Be sure when lifting an object that you keep it close to your body. This helps keep the body stabilized while lifting. When the object is too far from your back, additional stress is placed on your back. Get a firm grip on the object to help you keep it balanced. When lifting any object, be sure to do so with your legs. Your legs are stronger than your back. Use the strong leg muscles in your favor. When lowering an object, bend your knees and keep your back straight. In some instances, it is a good idea to use equipment made for such tasks, rather than attempting to lift an object on your own. Carts, dollies, forklifts, hand trucks, wheelbarrows, hoist, chains, and ropes are some items which can make lifting and moving items easier. Employees must make sure they are properly trained to use the equipment and are wearing the proper personal protective equipment, PPE. Good posture is important for a healthy back. When sitting or standing for extended periods of time, posture can affect the back either positively or negatively. There are several ways you can learn to support your back while in a standing or sitting position, as well as some exercises you can perform to protect your back. When sitting, keep your knees at a 90-degree angle and your feet flat on the floor. Slide your back in the chair and sit up straight. You may choose to use a small pillow in your seat behind the lower back to help provide additional support. An exercise you can try while sitting in your chair is tightening your stomach and buttock muscles. You should do this for 5 to 10 seconds. You should also occasionally get up and walk around if sitting for prolonged periods. If your job requires you to do much standing, make sure not to slouch with your back bent. Keep your back straight, shifting weight from one leg to the other every few seconds. Hold your shoulders slightly back and keep your chin, abdomen, and buttocks tucked in. Shift your position frequently. Raise one foot on a stool or step when standing stationary for long periods of time. Preventing back injuries requires proper lifting, good posture, exercise, and having a proper diet. The back deteriorates with age, and it's important to do everything possible to keep your back as healthy as you can. Performing certain exercises will strengthen the back, stomach muscles, and leg muscles, increasing the chances of maintaining a healthy back for many years. Proper exercise on a daily basis will strengthen the back and increase flexibility. Shoulder shrugs are one way to stretch your upper back. You can either stand or sit for this exercise. Place your arms at your sides and shrug your shoulders up toward the ears and hold for 10 seconds and relax. You should then proceed to the pelvic tilt. This is done by lying on the floor with your knees bent and feet flat. Tighten your stomach and buttock muscles to press your lower back against the floor. While still in this laying position, proceed with the hip flexor stretch. This is done by keeping one leg straight on the floor and your other leg bent at the knee. Slowly bring the bent knee up to your chest and press your back firmly on the floor. Hold this position for 5 seconds, then bring your knee back down and switch legs, repeating the process. As well as proper exercise, you need to maintain a proper healthy diet. Maintaining a proper weight reduces stress placed on your back. Choose foods that are low in sugar and high in fiber. For more information on proper diet, you should consult a medical professional or diet specialist. When lifting, you should always remember to plan ahead, bend at the knees when lifting or setting an object down, keep your feet shoulder width apart, lift the object close to your body, tighten your abdominal muscles, and to always lift with your legs. Remember to maintain good back posture, whether lifting, sitting, or standing. And it's always a good idea to stretch or exercise before work to reduce strain on your back. Only you can prevent the most common causes of backaches. The result is freedom from back pain and a stronger, healthier back.